in the frog to send blood to the arm and back, beginning with deoxygenated blood in the sinus venosus. It would travel into the right atrium, into the single ventricle, into the conus arteriosus, into the pulmocutaneous artery. From there, it could pass either to the skin or to the lungs through the pulmonary artery, and then into pulmonary capillaries where gas exchange occurs and the blood becomes oxygenated, into the pulmonary vein, to the left atrium, to the single ventricle, and to the conus arteriosus. From there, it would pass into the arch of the aorta, one of the two systemic arches, which will later fuse to form the dorsal aorta. Off of the arch of the aorta on each side comes a subclavian artery, which then passes into the armpit region and becomes the axillary artery. Then the brachial artery, which can then subdivide in different parts of the arm and form a variety of capillaries where gas exchange occurs. Deoxygenated blood can then return through a brachial vein to the axillary vein, to the subclavian vein, to the anterior vena cava, before returning to the sinus venosus. While in mammals, the fourth aortic arch on the left side becomes the arch of the aorta and then the descending dorsal aorta. In frogs, both left and right fourth aortic arches are retained. So there are two arches of the aorta which will then fuse to form the dorsal aorta. These subclavian arteries on each side of the body come from one of these systemic arches.